now, just so that we can put it up for anyone who's missed it, or you are more than welcome to come back and view this recording, so that if you missed anything while you're here. And then live transcript is available. If you press the CC on your menu button, it'll pop up if you need live transcript. All right, so this is the vision, mission, values, and goals for LAC DHS. They're recognized nationally as a model integrated health system. They're welcoming, inclusive, compassionate, innovative, excellent, and accountable. Their mission, vision, I can't speak mission and vision today, is to advance the health of our patients and our communities by providing extraordinary care. And then the mission, values, and vision for PFCC partners. The mission is center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision is a health system transformed, one that works with people and through communities as a partner in their well-being. And then some of our values, they are equity, inclusion, diversity, collaboration, and solution focused. So that's all of ours. Welcome. We'll do some round robin introductions to get started. We have a check-in question, and then we have Dr. Raggins here to talk about rebranding e-visits, and Lindsay will talk to us about portal guidelines, and we'll talk about the DHS forum and wrap it up for the day. So we'll go ahead with the introductions. Give us your name, where you're located, and what is your favorite tradition or holiday. So I'll start. I'm Laura Jackson. I'm the Director of Communities for PFCC Partners. I'm located in Eugene, Oregon. I used to live down in Southern California. My favorite tradition or holiday, I think, is Christmas. My family does Christmas Eve instead of Christmas Day. And so that we do our big celebration Christmas Eve night, go to midnight mass, and get to sleep in the morning on Christmas morning nowadays. We'll go ahead and I'll pass it over to Belinda.
Good morning. Hi, this is Belinda. My location is Los Angeles, California. And my favorite holiday is my birthday because it's all about me.
Nice. I love that. I love that. Thank you, Belinda. Thanks for coming. Ray?
Hello, good afternoon, everyone. My name is Ray Pizarro. I sit on the Patient Advisory Council for Rancho Los Amigos National Rehabilitation Hospital, and also sit on the County Commission on Disabilities. I guess my favorite time of the year would be Thanksgiving, because I'm a foodie and there's a lot of food around.
Nice. Yeah.
Especially when a large crowd gets together to share their favorite recipes. So I'm a sucker for trying new delicious food.
Nice. Yeah. I love a good potluck because I do get lots of recipes and new foods from those. Thank you. Ronald. Can you hear me, Ronald?
I'm sorry.
Oh, that's okay.
Mine would be, the same one, as the gentleman was, sharing Thanksgiving, because, you get together to share, with family, you get to talk about, good things and bad things, and then kind of like, to resolve, the things that are the family happening,
Mm-hmm. Absolutely. Thank you. Thank you for joining. Lindsay.
Was that Lindsay?
Lindsay, yeah.
Oh, okay. Sounded like Lindy. Hi, everyone. I'm Lindsay Galley. I'm the Director of Education at PFCC Partners. I'm actually located in Sacramento, California, up north here. My, I think, favorite family tradition before we got fake Christmas trees was going up towards Apple Hill, so a little, I think, east of here where I'm at in Sacramento, and we would kind of tromp around and chop down our own tree as a family. But haven't done that for a few years because the fake ones are a lot easier to manage and clean up after, but still one of my favorite traditions.
Sure are. Yeah. Thank you. Did I see Carlos join us? I see his picture. Oh, you're muted, Carlos. Right. You might be getting settled still. All right.
I apologize. Good
Oh,
afternoon,
that's
everybody.
okay. Hello. We're
How are
doing
you?
our intro question is, what is your favorite tradition or holiday?
I think my favorite holiday, yeah, it's Christmas because I start decorating about September.
Nice. I love it. I love good Christmas decorations. All right. I will go ahead and go to Dr. Raggins.
Hi,
Hi. Let us know your favorite tradition or holiday.
my name is Kyle Reagans. I'm located in Los Angeles, and my favorite holiday tradition, my family goes to Yosemite every year for Thanksgiving. So we don't do a big Thanksgiving meal. We just kind of go hiking and enjoy nature.
I love that. I love Yosemite. Soft space in my heart for that. All right. And then I will just pass it off to you.
Great. So can I share my screen actually? Because I have there's this video. I don't know if it'll work or not, but if it works, it'll save me some breath in explaining what e-visits are. Let me see. Okay, sure. Okay. So, my name is Kyle Reagans. I am the director of the urgent care clinics for LA County. So we've actually got 12 of them. Technically, I'm over 9 of them, and the other 3 are under hospitals. But today, I'm not here to talk to you about that so much. I'm here to talk to you about a type of care that is being rolled out in many different healthcare systems, including LA County. It's called e-visits. And it's been available actually in our system since January, and we've had quite a few people taking advantage of it. We've done more than 1,000 of these. But in talking with some other healthcare systems, they've named these something different. And essentially, I'm here to ask you the very simple question of what you think we should name these. So I'm going to explain what it is first, and then hopefully we can get you all to brainstorm, some names. I've got some possible names as well to kind of kickstart it, and then you can tell me what you think of different names or advantages and disadvantages. So basically, e-visits are a message-based encounter. You jump on the patient portal that you can do through the app or through the website, and it's available just like anything else on the portal 24/7, 365. You don't need an appointment, and you basically fill out a survey about your symptoms. And the surveys are designed so that it asks you specific things about what your symptom is. So if you're saying you have a headache, it asks you the questions the doctor would ask you when you have a headache. If you say, I'm having burning when I go pee, it asks you the questions the doctor would ask you when you're having burning when you go pee. And then basically it takes all your answers and sends it in a message to the doctor. And then the doctor replies in a day or two with some recommendations for you, which could include prescriptions. It could include them ordering some tests on you. It could include a note for work or school. And so for those people who, get frustrated that It can be a big barrier to go access care, whether that's waiting a long time for an appointment or, you know, a long way in the emergency department or urgent care. This is a way that you could do one of these in the middle of the night at 2 a.m. when you're having a headache, and, you know, have a doctor apply the next day with some thoughts about what might be going on with your headache. So that's basically what it is. I'm going to play a little video here. We'll see if this works or not. Maybe it'll work. I can figure out how. 1 second. I do. Stop sharing. I'm going to share again. But I'm going to share. Here, I'll share this. I'll just post this video in here.
E-visits.
Can you guys hear that audio? Okay, so this is a fancier version explaining what I just explained.
Did you know you can get tests and prescriptions ordered without having to come into the clinic or even doing a video visit? What are e-visits? E-visits are different from video visits. E-visits are a new option for patients to access care anytime 24/7 at their convenience through the LA Health portal. No appointment required, and patients do not have to travel to the doctor's office. Patients simply answer a series of questions about their condition on the LA Health portal, and a healthcare provider responds with a treatment plan, including ordering any necessary tests, prescriptions, and can even provide a note for work or school if needed. Most e-visits will get a response the same day, but all will get a response within 3 business days. E-visits are available in English and Spanish. How do I complete an e-visit? Try an e-visit today in 4 easy steps. 1. Log into the LA Health portal through our website or our mobile application. 2. Click on Start an e-visit on the right-hand side of the website or from the menu at the bottom of the app. 3. Select the e-visit questionnaire corresponding to your condition. 4. Answer the questions and then wait for a healthcare provider to respond. Download the LA Health Portal app or sign up on dhs.lacounty.gov/LA Health Portal and start using e-visits today.
Okay, so let me go back to my other thing that I was sharing. So I guess before I move on into basically what we've been discussing is UCSF created a version of e-visits, and they realized e-visit is the name of like the billing codes that are used by insurance companies to keep track of these visits. And a lot of systems have just been calling them e-visits. Kaiser Permanente has them called them e-visits. So we kind of called them e-visits and didn't think much of it. But UCSF did some kind of surveying, and they were like, nobody thinks an e-visit is going to be what an e-visit is, because visit sounds like it's kind of some kind of synchronous communication with the doctor, that you're going to be talking in real time with the doctor, but that's not what it is. Like, you send a message and then they reply, you know, a day or 2 later sometimes. And so they are calling theirs medical advice message, I believe is what they call theirs. And I am curious, I've got on this slide a bunch of different possible things we could call it. We could call it medical advice message. I'll say what I don't like about medical advice message is that it implies that you can only get advice, but you could actually get treatment through this. It's not just a way of getting advice. So we kind of have a few different possibilities. And then the other possibility is just to say, like, you know what? If e-visit is a term a lot of systems are using, you know, maybe patients will eventually just learn what it is and we should just stick to it. But I was curious to get the perspective of some patients. Is there some kind of terminology that would speak to you? They would say, hey, when I hear this sounds like it's going to be what it is, that it's a message that you send a doctor and answer some questions and you get, you know, a response a few days later with some treatment. And I'm also happy to answer any questions about e-visits itself. So I'll leave it there and kind of ask, you know, if you want to brainstorm some ideas for me, or if there's particular things that are on this slide that you like that one, let me know.
Thank you. Does anybody have any ideas?
I have an idea.
Mhm.
I think it should be left as an e-visit because that's exactly what it is. It's electronic, and this is going to become a thing of the future. Okay, we're not going to be able to call and speak to doctors anymore. And this is an easier way for us to communicate. It's going to be going through this portal. It takes the personal part of it out, but yet it works because doctors have too many patients now.
Well, I appreciate that you think that this is the way of the future, and I think it certainly is for some care. Just to reassure you, I don't think our plan or anyone's plan is ever that we would get rid of face-to-face interactions with doctors or phone visits or video visits. It's really for something that's really simple, like you're having you know, a urinary tract infection symptoms and you really just want a quick prescription for an antibiotic. If we can identify the people who are really simple, maybe we can treat them over a message. But the vast majority of our patients that come to us probably would be very difficult to treat just based on messages, because, you know, we have to be able to examine you and do tests and all that kind of thing. So it's not going to replace everything, but your
I know it's not replacing the
Okay.
doctor. You still have primary visits. I'm
Yeah.
speaking of as far as trying to communicate with them, because right now it's hard to call in and reach a doctor. And this e-visit is a whole lot easier to reach that doctor,
Yeah.
reach your primary.
So you said you like the term electronic visit because it is, you know, it kind of seems like it's an electronic way of the future. Does anybody else have any opinions on whether e-visit speaks to them? As like, when you hear e-visit, does that sound like, oh, I'm going to message my doctor and they're going to respond in a day or two? Or is there another term that would say that to you?
I'm sorry, was you talking? You still talking to me?
I'm anybody.
Oh, okay.
You sure, you too.
Well, I'd already answered.
Well, I guess I'll read off some of the ones that are alternatives here. I appreciate that you're like, just leave it e-visit, because that's definitely the easiest thing for us, is just to leave it as e-visit, because you saw like there's like a video that has it in there. We've got it already on our website, so we'd have to change a lot of stuff to change it. So if people don't think it's much of a value add in terms of understanding what it is, that may be the best path. But some of the other things that are written on this slide are, you could call it a medical advice message, which is what I mentioned UCSF calls theirs, a medical treatment message, a medical care message, a medical treatment email, because it kind of like works over email. It's technically through the portal, but it's kind of like an email. A doctor advice message, physician advice message, basic care message, on-demand care message, quick care message. Do any of those sound good to people, or do you have other ideas?
Yes, I think on demand, it sounds nice if they could get some kind of reply the same, you know, within minutes or within the first half of the day. As far as what the next steps are, if someone's available to connect with them instantly, or they have to wait a day to get back, then that will kind of defeat the on-demand part, because on-demand pretty means like I need to talk to someone now, immediately, or at least within the day. So
Yeah.
if they could do that, then I think on-demand would sound would be a good name for it.
Yeah, I'll say Kaiser Permanente currently has their setup where they try to reply within a couple hours. When we were first getting this off the ground, we just had no idea how much volume of these we would get, like whether, you know, one patient would submit one a day or 100 patients. So we didn't want to promise anybody anything too crazy. But now that we have a little bit more idea of how many of these we get and how quickly, we probably could generate replies faster. I will say one of the interesting things about these is we often end up getting them in the middle of the night. And I don't know if we're ever going to have a time when we're like, oh, let's have somebody, you know, just be on all night to reply to these in the middle of the night. It's probably always going to be kind of like next morning kind of thing. So that would be a disadvantage of the on-demand care message. But what I'm hearing from you is on-demand care is what people want. And so if you call it on-demand care, it's more attractive, but you should really make it on-demand care if you're going to call it that, as opposed to care in a day from now.
Yeah, no, exactly. And also if it's, maybe a little parentheses within business hours, I guess, or
Yeah.
not like 2 a.m. or something like that. But I mean, you could put a little more elaboration on what that on-demand care would entail, right?
Yeah, we definitely can. I mean, like when people click on it, there will be descriptions of what it is and what they can expect. It's more just like, what do we name it and how do we brand it? The other thing that you're making me think about that maybe is relevant to bring up with this group is what we've often found is patients, are seeking care kind of after hours, and they just kind of poke around the website and they just submit kind of everything. So you'll have patients who are like, they submit an e-visit, they make an appointment for themselves in urgent care, and they request an appointment with their primary care doctor all at the same time. And then we kind of have to figure out, well, like, oh, which of these is actually going to treat the patient's problem? But I think it speaks to what you're saying, that people just want to get care, and they're like, I don't know which of these things is most likely to help me, but I'll just try them all. Any other thoughts? I don't want to take up, more time than necessary if there aren't other people that have thoughts, but I do want to make sure if other people have thoughts as we've been having this discussion, if you get a chance to share them.
Quick response.
Carlos, did you have a thought?
I was just thinking, he said they had quick response on it.
Yeah, like a quick care message, we could call it something like that. Because one of the things is we really don't want to use this for like complex care. It's supposed to be for relatively basic things. Because if you say, hey, I have this really complicated medical problem, you try to submit one of these, our response is going to basically probably be like, there's no way I can treat this over message. You have to come in, we have to examine you, and we got to figure out what's going on. It really only works if it's something pretty simple.
I'm sorry, can I say something?
Yeah.
Absolutely.
Yeah, this really does work in a perfect way, because just last week, I needed to talk to my doctor in regards to some of the things that I needed for myself. Just being patient, and of course, you gotta understand that they're also, during the day, they're kind of busy. So, I said, well, I'm gonna call my doctor, the next day in the morning and leave a message to them using the portal. I did send a message to my doctor requesting some orthopedic shoes. And next thing during the day, I went to go check, and there was a message from my doctor, saying that for me to expect, a call from the orthopedic department. And, and which I did got a call from them, and also set up an appointment, and which was, everything was so smooth. This is I don't know how can I explain this, but this is a good way to schedule, to, like you say, to ask the doctor, whatever, you're feeling, whatever you need, this is the best way.
Well, I'm glad, or I'm happy for your vote of confidence that this is something that you think patients will use and that could be useful to them and work for them. I think that's the most important thing at the end of the day, and then branding or naming is just, it is what it is. It's just a matter of patients learning what it is so they know where to click and where to go to access it. Okay, I mean, I think I'm okay, unless I just want to make sure nobody has any other last comments they want to make, but otherwise I will hand the meeting back to Laura, and y'all can continue on. I really appreciate your input. It's really helpful in us in figuring out the best way to move forward and making sure patients are aware of this research for them.
Thank you. Thanks for coming on and getting the patient's ideas.
Yeah, absolutely. And I actually have to jump off to another meeting, but I appreciate all y'all, and I would have loved to hang around and hear the rest of it and have another meeting. But take care, everybody.
All right, thank you.
Thank you.
Thanks.
Let me reshare here. All right. We'll go ahead and move on to our next discussion. I'm going to pass it over to Lindsay for patient portal.
Yeah, thanks, Laura. And this is kind of building on what Dr. Raggins brought with the e-visits. So in conversations with Miguel, who unfortunately couldn't join us today, he's typically here every month, but he's taking a well-deserved break with his family. But we were talking with him, and the team working on the patient portal has noticed, not often, but occasionally, some of those messages that are going through with the e-visits may not be appropriate all the time. So some of the messages may have inappropriate language in it, not the most appropriate photos that are being sent to the physicians as well. So wanted to bring the concept of creating some patient portal guidelines. So kind of guidelines for patients to help them use the e-visits or the messaging in the most appropriate and efficient way. So on the next slide, I just had a few discussion questions to, help us kind of kickstart the discussion. And I think a lot of you have been a part of other patient portal discussions. So we'll build on that. And Laura, if you just click through, I think I did some animation there. So just a few questions to respond to. Curious how you use the patient portal. It sounds like many of you have experience using the e-visits and the messaging. Curious what types of messages that you have sent through the patient portal. So Ronald, thank you for sharing your most recent experience getting orthopedics. I think that's fantastic that you were able to do that so seamlessly over the portal. So what are those messages that you send? And then what are some guidelines that you would recommend from, your own perspective of using the portal to make sure that those messages are appropriate and efficient? And then any other comments. So we'll just open the discussion up. You can respond to any of those questions.
I'm sorry, with all this information we're getting from the how to work the LA Health portal, it really helps to discover, lots of things that we could, get benefit, off of the portal, because if you download it into your system, your phone or your computer, you would just like look at it, but you don't know how much information you could get off of it, and just like what you guys are teaching us right now, it really helps us, to go ahead, and accomplish everything that we need.
So explain the benefits of using the portal is what I'm hearing, because I think you're absolutely right that it's quite a tool for patients to use. So I think just putting that out there a little bit more. So that's really helpful to make sure folks will use it. Carlos, did you have a comment? You might be on. Yeah, I think you're on mute. Hopefully he's not talking to us. We can't hear you, Carlos. Ray, I saw you come off mute. Did you have something to add?
Yeah, just how to use the LA Health Patient Portal. Like definitely for quick quick blood results and test results. And also like upcoming appointments are really handy, and and the option to add the calendar appointment to your phone is great. You know, those are like efficient ways to stay on top of what's coming. And also the ability to message doctors is great. You know, you could elaborate and let them know how serious or not your issue is. And this way you could get back with a game plan of either coming in ASAP or, you know, giving you some direction or suggestions to keep you healthy until, you know, you see your specialist or your doctor when your upcoming appointment is.
Yeah, I agree. I'm curious what you would, or how you would help a patient if it's their first time using the portal, their first time sending a message to their doctor. How would you kind of describe how to, you know, write that message out, maybe, or how to put a message out to your doctor?
Oh yeah, I definitely would really keep it simple.
Okay.
We don't want to overwhelm people because we don't know where they're at technically using these type, how tech savvy they are. So I think asking questions, have you used any type of, are you good with apps? Do you use them? If they say, oh no, this is my first time or whatever, then you got to kind of meet them where they're at and be like, well, to start off, here are the top 3 things to look at in the app so you could know how to access them, right? And then the message part would be an important one, obviously. And maybe I would ask them, what are the important parts out of these 3 things that you would like to learn that you could remember? And if he says, oh, test results, then I'd focus more on that. Oh, connecting with my doctor. Then I'll focus on that a little more and lightly mention, oh, here's where you find this other ones. Because some people really need to be walked through stuff and have the patience to do it. Because just tell them, oh, download the portal app to do A, B, C, D, E, F, G. It's easy to say, but it could be overwhelming for most. And that's why, like at Rancho, we have the Disabled Resource Center.
Yeah.
Where people are specifically there, not only to enroll people, but also to walk them through these steps and spend 30 minutes, an hour if needed with people to absorb how to walk them through. And that's key, I think, in order for them to use it regularly, is have someone dedicated to walk them through it with, you know, that has patience and to come full circle, and then him feeling comfortable, and also letting him know, look, all right, today was a good day. We got introduced, you know, where one thing is, if you want to come another day to work on something else, is good. So always leaving that door open, because they could get home and forget what kind of we told them how to use. So I think having that constant follow-up and followed through is important.
Absolutely. Those are great points. And you're reminding me too that at, I believe, most of the facilities, they have, I'm not going to remember their titles, but it's something like health technology navigators that are there to help get patients onto the portal and help them understand how to use it. So I think what you shared are some really good points. And then any other guidelines that we have for messages with your doctor, I think those health navigators will be great people to, you know, connect with and do exactly what you said. So, okay, you're signed up for the portal now. What do you think that you'll use it for? Is it going to be checking your test results? If it is, okay, let's spend a little bit more time there. Or do you think that you'll be messaging your doctor a lot? All right, let's take a moment to walk through, you know, what is the best way to get your message across, and just like you said, keep it simple. And so that, I think that's really helpful.
Yeah, and one more thing, just if I could add, a thing I like to do
Mhm,
is I also mentor as
Mhm.
well at Rancho. So what we practice is having people exercise a notepad and pen
mhm.
when they come see us, and let them know, grab a piece of paper, okay, here's a pen, and let's go through these steps, and let's start by step 1, 2, and 3, how to complete a message to your
Mhm.
doctor. Write it down. Okay, 1, go here, 1, go there. And this way they have little bullet points. And then when they get home, they could kind of practice that,
Right.
because a lot of people are better at writing stuff still instead of typing it on their phones just to get them going. So,
Very true. And I find too that, you can absorb information, but it's when you're actually going through those steps is when you learn how to do those steps. So I like writing them down, and your whole point of going and practicing too. So maybe you don't need to send a message to your doctor right away, but you can kind of go on and kind of go through the steps that you've written down and say, okay, when I get to this point, I would then send my message. So great ideas. And Carlos, I see you rejoined. I think you were on mute. Did you have anything to add to the discussion about guidelines for patient portal messages?
No, I think pretty much Ray was right on it. Okay. Maybe also, because you're gonna get a lot of trolls and you're gonna get a lot of misinformation.
Right.
So maybe you should tell them, put a specifically a little notice in there that says, remember, save the questions or save the answers, or save the more personal ones
Yeah.
to when you talk to somebody. So,
Oh,
just
yeah.
remember, you remember you're going to be online.
Right. Great point. So save personal information until you're in person with a doctor.
Right. Or whoever calls you back,
Right. Right. Sorry, just taking some notes.
Yeah. And to keep your questions simple, because if I go in there and tell you, well, I got this and I have this and I have this, you're not going to know who to refer me to.
Right. Yeah. I definitely took that one away. Keep it simple and to the point. Because when you add too much in there, it can kind of confuse whoever's reading that message too. Just like I think that Dr. Raggins was explaining, if there's, 3 separate ideas in one message, it's hard for them to break it down and figure out exactly what you need. So I think that's a great piece of advice.
yeah, well, just to add real quick,
Mhm.
Carlos made a great point. Because yeah, when we jumping into this new technology and messaging,
Mhm.
privacy is really important to us, and we don't know where that message is going to land first. So, and
Yeah.
how many people are going to screen the message before it goes either to the initial screener, the department head nurse, and then the doctor. So it's touching like 3 people or 2 people before it gets to who you want it to get to. So I think having some information about who it goes to,
Yeah.
like would ease people's like mind of opening up and maybe giving more detailed information about their personal care, because some are very sensitive, and maybe a lot of people hold back from really describing the location, the issue, could be embarrassing for people, it could be
Right.
traumatizing to just talk about it or type it, and then it gets to 3 or 4 people, and then you're like, oh God, everyone knows my business. So I
Right.
think that's important.
So kind of describing the process that your message will go through, whose eyes could potentially be on it throughout that process. That's a great point.
Right.
And Belinda, curious if you had any thoughts to add or any guidelines that you would recommend to other patients using the messaging on the patient portal?
No, I think what Carlos said was really good.
Mm-hmm.
I I don't know. I guess I want to say with me being older, it's like I really don't care for the portal. But like I
Mhm.
said, I know this is something coming into existence and I have to deal with it. I'm used to dealing one-on-one with a doctor. I'm not
Right.
used to going through all of these ways just to
All the
speak.
hoops.
I understand, I'm trying to change with the time, but come on, it's difficult, okay, but
Yeah.
I'm doing it, and I haven't had any problems yet.
Mhm.
I
Mhm.
had one situation. I was trying to connect with my doctor. I had a procedure coming up and I wanted to talk to my primary, but I was unable to talk to him prior to the procedure.
Mm.
And I think I was able to see him a week later. Stuff like that kind of puts me on edge.
Yeah. Mhm.
Yeah, I came through a lot medically, and I don't want to just throw my health care to the wind, okay?
Right.
And even when you were discussing the different names for it, if it says the care, like the primary care, if you're going through that little care name, then to me you should be able to get instant care.
Yeah.
I understand the doctor's not sitting at that phone 24 hours, but you should be able to get some kind of immediate response. That's what that patient is looking for. Because
Right.
just we aren't just looking for immediate all the time, but
Yeah.
sometimes you need to know now.
Right.
And that kind of leaves me, I'm leaning in trying to understand, but at the same time, this is something that's going to have to be watched closely.
Mhm.
And then
That
especially with whatever the patients are going through.
absolutely. Yeah, that's a great point. And I'm kind of thinking, I know Dr. Raggins had described what Kaiser is doing, and I know at Kaiser they have a nurse advice line that's 24/7. So I'm going to see, and maybe that would be helpful because I worked with another organization too, where there were these multiple places where patients could go for
Yes.
questions or things like that, some that were more urgent than others. And we were able to create this visual that said, okay, if these things are happening, this is urgent and this is who you call. If these
And
things are happening, it's not that urgent, you can use the portal message. So
exactly.
yeah, something like that.
And my daughter is a member of Kaiser, and
Mhm.
she had a situation where she felt like she had swallowed a piece of glass, and she hadn't. And we had called in, and I was able to talk to a nurse, and the nurse was able to give me some resolution as to what to do. And
Right.
about time she heard back from her doctor, she was already cured. And
Yeah. Yeah. See, it's a great resource.
so,
Yeah.
yeah, see, sometimes you need help now because you're not sure which way to go and you don't want to be laying in the floor twitching from making the wrong decision.
Right. Yeah. Or you don't want to go to the ER when you don't have to
Exactly,
either. Yeah.
unnecessarily.
Yeah.
Exactly.
Yeah.
Exactly.
No, that those are great points, and I think a really good discussion. So I'll take that back to Miguel and see if maybe we can't create some sort of resource like
Thank you.
that that
Because see, we
says,
could use
yeah,
the e-visits. That's perfectly fine.
oh yeah,
But in a
yeah,
crisis, we need help now.
what do you do? Yeah, yeah, what do you do? No, that's absolutely, I hear you. Great. Well, this has been really helpful. You've definitely given us some good ideas to go off of. I think these guidelines that we'll kind of start to put together are just in the forming phase. So we'll put this discussion on the forum as well, and just ask for additional ideas on how we can help all of you and other patients make the most of the resources that are available to you, including the patient portal. So
Thank you.
Yeah, thank you very much. And I'll pass it back to Laura, I think, to wrap us up. But yeah, thanks for your time.
Thank you. And that actually leads us perfectly into the forum, just as a reminder that it is there for you to start discussions between our community conversations. If you have any questions that you have that your peers can answer, or any discussions you would like to have in between our community conversations. We'll also follow up this meeting with a post in the forum about both topics of the rebranding the e-visit and the patient portal guidelines. So if you think of something tomorrow, or I always think of stuff after the fact, I have ideas after the fact, feel free to add it right there into the forums. And Lindsay, thank you, added it into the chats, the link to the forums there. So again, feel free to head on over there and join the discussion. And then our wrap up, our next meeting is Monday, August 22nd, same time, same place, 3:30 to 4:30 p.m. We going forward are doing simultaneous translation. So thank you, Martin, for joining us today. So if you have anybody you know that you want to bring along to our next portal, I read it right there, the next hub community conversation, feel free to bring them along. And if they are Spanish speakers, great, we've got that translation. So thank you for joining us, and we will let you guys go about a few minutes early. If you have any questions, we will stay on too.
Thanks, everybody.
Thank you.
All right. Thank you very much for everything.
Yeah, take care.
Bye.
Bye.
Bye-bye.